Hello and welcome to everyone joining us from around the globe. Thank you for being part of day 2 of our special series of webinars on COVID-19 dedicated today to space for healthcare. I'm Donatella Ponziani, ESA Downstream Gateway Officer, and I have the pleasure to be the moderator for this session. The outspread of COVID-19 pandemic jeopardized the resilience of the global public health systems. Chilling warnings about a potential risk for the world of a major pandemic at some point were given by Zika, Ebola, SARS, MERS. The medical systems that step up to treat patients in front of those emergencies always experience severe shocks. But prospecting the right action where you are confronted to a medical crisis, a new virus, without leaving behind patients affected by other diseases is always a challenging and complex task. The question we would like to ask is, how do we prepare for the long run? What are the needs of our society and of our medical systems? What are the technological advancements we can leverage on to face an emergency and to improve the resilience of the system? And of course, what is the role of space? How can we help? To tackle all those questions from everywhere in Europe, let's bring in our panelist, Jan Werner, ESA Director General, who is hosting us. Thank you. Vanessa Candeais, former head of health and healthcare industry and member of the executive committee of the World Economic Forum. Elizabeth Alley, former ESA medical doctor at the Concordia research base in Antarctica. Walter Ricciardi, professor of hygiene and public health at University La Cattolica in Rome, and Fabienne Schneider, senior program manager at Médecins Sans Frontières. I thank them all for their availability for being with us today. For those in the public who would like to join the conversation, please ask your question on our social media, Facebook and Twitter, using the hashtag AskESA. Let's start right now with a first question to Walter Ricciardi. Walter, you are professor of hygiene and public health. You are also advisor of the Italian Minister of Health. Let's talk about the resilience of our medical systems. What are the lessons we are learning towards the COVID-19 crisis?
First of all, most of the people say that this was a surprise. This was not a surprise. Many public health scientists, many epidemiologists have been warning the world for decades in saying that this was going to happen and weren't essentially ignored. And we had a kind of complex of inferiority, in seeing that essentially we were unheard. But we were surprised when a guy like Bill Gates was unheard as well, because he not only gave a speech in 2015, but he also wrote a paper published on the New England Journal of Medicine warning that the world was unprepared for the next pandemic. And this was also ignored by the decision makers. But essentially, the first lesson is that for the next one, we have to be prepared. We have to understand that this is something that is going to happen again. And of course, we have to practice ourselves in order to find ourselves not disoriented as it has been in the first pandemic. The resilience, you say, Donatella, the resilience was mostly on the shoulders of healthcare workers. So essentially, the people that fought sometimes like heroes in the wards, in the hospitals, in the emergency departments, in many cases without personal protective equipment. So they really paid a high price for this. And this is something that next time shouldn't happen. So in other words, the Western world delegated to some developing countries the responsibility to produce this because it wasn't kind of profit-making products in the West. And so things like masks, gowns were very much lacking in the Western world. And so at least for the first months, the resilience of the healthcare workers was really only on their shoulders. So the lessons for the future that we have to practice ourselves And we have to develop a proactive, not a reactive approach. A proactive approach, which means that we have to strengthen our health systems. We have to change our way in which we look at health. Health is an investment, not a cost. And also we have to work all together. We have to cross our silos and working all together, not only in the field of health, but social sciences, economy, and why not, even space science. It can, I think, help with the digital transformation in managing the next pandemic.
Thank you very much, Walter. I would like to ask now a question to Fabian, actually almost the same question. Fabian, you are senior program manager at Médecins Sans Frontières. Médecins Sans Frontières has a long-lasting experience in managing health crises in areas where the access to health is not guaranteed. The COVID-19 showed us that it has no border, it passed the border, and it also arrived in areas where normally health is guaranteed. What are, from your point of view, the lessons we are learning, and what are the needs on the field?
Thank you, Donatella, for this question, and thank you for having me in this panel. I should mention that I'm also here in my personal capacity and because of my work as a humanitarian for many years. So what are the learnings? What are the needs? Okay, I have a few points here. But I think that this pandemic makes humanitarian organization to have to learn many things rapidly. But I think that what we are learning the most is that we have to find new ways of working, to develop partnerships and to use digital technology to rapidly adapt to this new context and needs. And from the perspective of a humanitarian organization, this becomes to be global and not just in low and middle income countries. So today, humanitarian organizations can no longer implement the models they are most prepared to deliver in such crisis. And you mentioned Ebola before, like even the Ebola crisis seems to have been somehow more manageable if we compare it to this current pandemic. It is interesting to see that the learnings from responding to the Ebola crisis and from the management of outbreaks of infectious disease in past years made MSF to be able to transfer expertise gained during a humanitarian crisis to the non-humanitarian sector. And some of these learning have been around IPC, infection prevention control, treatment center organization and management, use of digital technology in that particular context, data, crowdsourcing for epidemic monitorings, communication, etc. An organization like MSF and in general, those organizations are developing, have no choice actually, to develop contingency plans and funding strategy to ensure the continuations of their current medical and humanitarian activities in low and middle income countries, as well as supporting intervention in high income countries. And this is a bit new, at least for the perspective of MSF. MSF is very concerned about the consequences that worldwide restriction on movement and people and stocks may have on regular operation and emergency response capacity as we speak now and in the near future. An organization like MSF remains committed to continue the provision of services in the area where it works, working on preparation for the disease in most of its projects, including organizing digital by the distance training for medical personnel, even on basic infections, on prevention and control measures, and is rapidly and very rapidly scaling up telemedicine services so that it can continue treating all categories of patients, including those suspected of COVID-19 who may approach the health facilities. At the same time, and this is new, MSF have also started to work in high-income countries, contributing to address the needs of vulnerable group of population, often through partnership models with local and national organizations. And this is happening in Europe, in the Americas, including the US, Canada, Brazil, France, Spain, Italy, Greece, to name a few. So And those activities include both like the standard model of in-presence intervention and include, and even more today, the support of digital technology. We do provide infection prevention and control training and facility adaptation at both primary and secondary level. Institutional and strategic and technical advice to vulnerable groups, and this include working in residential institution, in transit camp and shelters for homeless and migrants population, and increasingly in old age home. Provide also individual support, so for information and guidance for vulnerable, similarly migrant and refugee group of population, and specific groups for example, pregnant women in migration, people living with non-communicable disease, HIV and TB patient, chronic condition, etc. In some contexts, we use technology to monitor certain category of positive patients, ensuring that we can reduce the load on health system, and often that is already very much weakened, doing triage, home monitoring, referral based on alert system, and peer-to-peer support. So in my time with the humanitarian sector, I'm about like 20 years in that sector. I have not witnessed so much effort from large organizations to morph their operational responses and strategies to meet the needs of this pandemic. So the empowerment of national resources, more locally sourced supply, 3D printing of protective equipment, distance training, just to mention that MSF has organized 500 webinars in 3 months. Institutional support via call centers, increased telemedicine usage, but also project closure and suspension of vaccination campaign are among the coping mechanisms that NGOs are now implementing. So thank you.
Thank you, Fabian. And I would like to build on your witness with Beth. But you are, from your experience as a ESA medical doctor in the Concordia mission in Antarctica, and for your actual involvement as in the emergency for your country, for the COVID in your country, what can you share with us in terms of the need you have when you deliver a medical assistance in very extreme condition and when time runs against you?
I guess the biggest thing that I've noticed is how similar the two environments are, really. So I think that I brought a lot of what I've learned from Concordia and a lot of the research that we were developing, sort of tools and technology, especially telemedicine, and how we're able to use that clinically. And I think that that's been really exciting to see. I suppose from sort of the early stages of the disease, it was really useful to have sort of disease mapping and modelling for us to be able to predict the different risks that our different patients have, especially in terms of where they've been travelling to, and how that was being able to be updated so quickly. I think one of the really exciting things that I've noticed during the COVID crisis is just the sharing of information globally that we've been able to achieve, and how quickly that's been able to be disseminated as well. So we really have been able to learn from different responses from different countries in a way that we've never really seen before. And also being able to maintain that sharing of information at a time when we're not able to have sort of normal teaching sessions as we would be used to in a hospital. You know, all of my teaching and learning, which is normally done in sort of small groups, is all being moved on to Zoom platforms or different kind of telemedicine platforms, which has been a real change in the culture, but has been really effective and really useful for us all sort of facing this challenge where, you know, just a few months ago there were no experts. So we've all been having to learn together in a sort of new and unique way. And then just clinically, sort of on the shop floor, as it were, you know, just really seeing telemedicine being used. And also in terms of communication, because in intensive care where I'm currently working, currently we're not able to have any visitors. And this has been a real challenge for families and for patients as well, not to have that sort of normal communication. And we've been able to use video calls and things to maintain that during these really challenging times as well. And even for communication between doctors and nurses. So we have sort of within the intensive care unit, normally patients with COVID have sort of a 2-layer seal with with sort of glass doors. And although you can kind of see all the monitoring and things, it has been really useful to be able to walk around those wards using telemedicine devices as well, so that we're able to sort of monitor and change ventilation settings, for example, and actually save some of the personal protective gear that otherwise we'd have to have used, just to go in and make those small changes as well. So that's been really exciting. Also really exciting in terms of apps and things that have allowed people, so for example, Good Sam app here in the UK, it's allowed lots of people to volunteer really quickly and be sort of directed to appropriate positions as well. That's been really exciting to see. And also looking to the future, we've sort of seen drones supplying personal protective gear and all sorts of sort of remote technologies which have really reduced the risk for people by reducing the amount of interactions that we're having to have, and also saving the personal protective gear, which we all know is a minimum as well. So so it's been really exciting to see that all on the front line. And I guess the other thing that I've really noticed as well is sort of astronauts and also people working on platforms like Concordia, and research that we've been doing into isolation has also been useful for people that have been self-isolating at home, because of course that's a huge challenge as well, social distancing and the sort of psychological mental health impact that that's likely to have, and to be able to sort of share coping strategies and mechanisms from sort of human behaviour performance training and research that we've been doing has also, I think, been really useful for people as well in this sort of new world that we're living in.
Thank you very much, Beth. Jan, I would like to ask a question to you. With respect to all these elements that have been provided by other panelists, what do you think space can do in response of a pandemic? What is our role in prevention, early warnings, diagnosis, treatment?
Thank you, Donatella. Yes, it's right. ESA and space can deliver a lot of things. Before I go to details, and we might have an opportunity later on in this discussion as well, I would like to see why I'm saying that. Because if you look to the logic of this pandemic and other pandemics, and look to another effect we have, this is climate change, there are very many similarities. What I mean is the following. We heard already at the beginning that it was not a surprise, but it had to be discovered. The effect had to be discovered. The virus had to be discovered. Without discovery of the virus, nothing would work. And this is exactly the same how space is working, for instance, for climate change. The climate change had to be discovered. It was there, but nobody knew about it, so it had to be discovered. So discovery is number one. The second thing is you have to monitor it. Again, we are monitoring the climate change all the time. We are monitoring the climate change, and the change is not only on Earth, but also on Mars, on Venus, and other planets. So, and it's the same with the virus. Without monitoring, you would not see that it's a pandemic. So the third step is to raise awareness. Again, climate change, without raising awareness, there would be no effect, so to say. We would not really convince people to work against this. And that's the same with the pandemic. You have to raise awareness to make people aware that there is something, because only then you can fight against it. And only then, after you have discovery, monitoring, raising awareness, then you really can mitigate, either by protection or fighting against it as we do. So already this logic of what we are doing in space and what is the right method for a pandemic is very similar. And this is all based, and I would like to repeat this one, on the discovery part. So the curiosity to find out what is happening. And I think there, space is a good example, because we are driven day by day by curiosity. We are trying to understand what we never understood before. So to understand black holes, dark matter, all of this, we don't know what it is. We want to understand, and this is driven by curiosity. And I believe for these health issues like a pandemic, it's very important to have this curiosity as well, to understand what is the cause that people become ill. So you just can measure fever, but this is not to find the cause. So you have to go closer and closer. And therefore, this is already something where we have big similarities between space and health things, especially with the coronavirus. But of course, and maybe you ask me later again about that, there are also very concrete effects, very concrete things we can do from space also to help in this situation.
Yeah, we can do a lot of things. We are really invested in telemedicine. I have already heard from the three of you, our non-space guests, before in your speech about the importance of telemedicine. I think we have something. What is, in your experience, what you would like to have? What you have, but what you would you like to have more? I asked the question to Fabienne and Beth.
I can start if you want. Well, I thought about this. But we need a lot more, but we also must be realistic with what we can achieve and keep being that what we are, it's healthcare providers. I would like to say that when you mentioned the power of telemedicine in your question, I thought that how would my colleagues at project level will respond to that question. So I went back to some of the surveys we did, and the power of telemedicine is said by users in projects, and obviously I'm a humanitarian actor, so I have that perspective. He said to reduce isolation so that clinicians can share, discuss, and find answers to their questions, or to validate their diagnostic or the treatment they have decided to put in place. It is also said that it reduces barrier and privileges, in the sense that it makes unique expertise that we all have in this panel available where and when they are rarely available. So there are many contexts, including in the long-term care in developed country, where some of the expertise is or was not available, and telemedicine can help through that. So the telemedicine and its expertise can easily be made available to medical professionals worldwide, and can enable accurate diagnostic and treatment by providing access to global networks of clinical expertise, and this is a bit new. And then telemedicine is a fantastic tool for continuous medical education. So there is a lot we can do if we can make available proper regulatory and operational frameworks. We can make available robust IT infrastructure and sufficient resources. So I'm a program manager with one of the largest humanitarian telemedicine network in this sector. And what we're seeing is an increasing demand for digital services to support local teams and to compensate for reduced availability of human resources and other capacities. The current usage of telemedicine services, when I include emergency and non-emergency care, appear to cover the main specialty areas where telemedicine is likely to be useful in most medical facilities in near future, which is almost all of them. For example, the program I'm working with is reorganizing its tele-expertise services to manage a growth, allowing for increased capabilities and management of much higher volume related to COVID-19 or not. Also, because the way we are working is changing because of this pandemic and the next one to come. The demand for real-time and near real-time telemedicine support and for direct and indirect transfer of knowledge are also on the rise across all of projects. And this is mainly and mostly driven by field users, not by headquarters, by field users. So what we must consider as we want to support more penetration of telemedicine in COVID-19 or not, it's increasing availability of smart portable technologies. In general, the necessity for organization and government to be equipped with those safe medical and operational models for telemedicine, to ensure support provided through digital technology meets the user's expectation, the requirements of international regulatory frameworks, alongside with matching local capacities. And finally, organizations and governments must manage their exposure to liability and responsibility to secure and protect medical data and patient privacy. We definitely need to have access to big data to support developing predictive model, to prepare and anticipate fast response for the next to come. For data to be available to all, representing the global needs beyond those who can afford modern technology, so it should be available for all. And to make access to robust and sustainable technology a priority for all, particularly in the healthcare sector. So with telemedicine being available in our toolbox as humanitarian actors, there is and will be hope and ways to continue delivering efficient medical assistance during pandemics. If we can capitalize on the current effort and with the support of space. So that was my contribution. Thank you.
Thank you, Fabienne. And what is your experience from the field? Fabienne was mentioning the field users will make the future of telemedicine. You were a field user. You have been a field user.
Yeah, I've been a field user, yeah. And sorry?
No, I was asking the same question to Beth about our experience in Concordia in Antarctica.
Yeah, I mean, it really has been amazing to see the speed at which everything's changed. You know, just a few weeks ago in intensive care, we didn't have all the sort of tablets and the facility to do all of the sort of home calls to family, and also for us to have that communication between the nurses who are sort of in with the patients and maybe sort of other healthcare professionals who are outside of the sort of enclosed areas. And I think it's been amazing to see the progress that has already been made. And even if this pandemic happened just a few years ago, I think it would have been very different to what we've experienced now in terms of our capabilities in terms of telemedicine. And I think that space technology has a big part to play in that. So I think that's really exciting to really see sort of on the front line telemedicine being used and being really effectively used in the management of the patients that we're seeing. I think that there's definitely still scope, of course, for improvements with that in terms of, you know, something like virtual reality, of course, would be an amazing way to sort of really feel like you're sort of in with the patient, because currently there's a big disparity between sort of looking on a screen and really seeing patients as we're used to. And that's not only just because of sort of physical barriers, but also obviously when you're wearing all the personal protective gear and the challenges that brings in as well. And also the challenges that brings in terms of the procedures that we're doing too. And I think there's also scope with that for the use of sort of robotics and sort of more assisted interventions as well. Or already with intubating patients, where you sort of put a tube in to help them breathe on ventilators now. A lot of them have sort of a computer screen attached to it, so while you're intubating a patient, you can see on a screen what you're doing, and that's a very new thing that's only sort of come in over the last few years, and again a really interesting use of telemedicine, but also protects the practitioner as well, because you're having to sort of get less close to potentially infected patients, because at the point of most of the intubations, we're not sure if people are COVID negative or positive because of the time in which it takes for the tests to come back. But yeah, I think it's really exciting to see it being used, and sort of every day when I'm going into work, you know, you see more and more sort of tablets and telemedicine facilities, sort of remote monitoring and remote sensing, and it's sort of improving, and we're really seeing changes every day with that. And I think it's also important as well to remember sort of vulnerable populations at home. Right at the beginning of the COVID outbreak, a lot of people were frightened to go into emergency departments, and so people were presenting really late to hospitals, and that meant that lots of the patients that we're seeing were much sicker than they normally would have been in the past, because they would have presented to us much earlier. And also a lot of sort of vulnerable elderly populations as well, who weren't having sort of that normal interaction, not having family and friends coming to visit them on a sort of daily and weekly basis, were sort of falling over, breaking a hip and not being found, unfortunately. for a little while. So, but using sort of remote monitoring and again remote sensing, sort of full monitoring falls at home, and also having tablets and sort of telecommunications with friends and family has been really useful, and also to be able to access healthcare systems in a very new way for a lot of people has been really, really exciting to see, and I hope that it continues.
Thank you very much, Beth. Vanessa, you are former head of health and healthcare industry for the World Economic Forum with a big experience in big data and digitalization. We have been listening to the other panelists on the importance of digitalization. How an acceleration in the digitalization of the healthcare system will impact and improve the resilience of the entire system?
Thank you, Donatella. And it has been very interesting to hear what everybody was saying, because that really speaks to the transformation that we had been seeing for the past 5 years, but that this pandemic really just made everyone put their metal to the pedal, right, to really accelerate this transformation. And so where do we see that digitalization happening? If you think of the continuum of care, as you were describing before, we see it in all aspects of it. We see it within prevention, and we see not only for patients that are, or for people that are worried about COVID, but a lot being used in terms of support for mental health, support for chronic conditions, in the prevention category, right? Either you're using an app, or you're talking to your doctor, or you're talking to your nurse, or if you've had a baby in the midst of this pandemic, you're using either telemedicine or daily logs where you can share with your midwife or with your nurse or with your physician the progression of yourself, of your recovery, and of your baby. So you see a lot in the prevention category. You see a lot in terms of screening. And in many countries, because the healthcare systems were overwhelmed with demand, you saw that countries put in place a lot of digital tools where individuals could see, oh, I do have 3 out of 5 of these systems, let me make a call to the line of support, or let me go directly to the emergency room, because this is what it should be done. And also in terms of the screening, again, we are in a pandemic, but all of the other conditions didn't stop, right? And we know that the burden lies in chronic non-communicable diseases. So cardiovascular disease, diabetes, chronic respiratory diseases, mental illness, cancer, all of that normally requires full teams of care. So a lot in terms of that technology has been able to support. And then if we look through the continuum of care, if you look for screening and diagnosis and treatment and care, all of those, a lot of solutions have been put forward. And because governments are wanting to provide further support to populations and to individuals, you've also seen willingness from the government side to say, okay, let's put in place the framework so that people can have access, increased access to these technologies, so that we can manage their conditions in a more with a more positive outcome. Now, so that's if you think in terms of the continuum of care. Then if you think of the healthcare workers, as both Kelsey and Fabian were referring to, you see that, you know, a lot of the tools are just on their tablets, on their phones, on their pockets. And that has meant that there is much more sharing of data. There's much more the ability of physicians and nurses and support staff to have access to the same information, and therefore be a more efficient process. And then for the patient itself, that you want patients to own their own data, to have continuous access to their full electronic health record, not just this time that I went to the hospital and I did XYZ. I want to have everything in one single platform. And we're seeing quite a lot of efforts in terms of being able to respond to that. Now, what we also see then is that data is coming up, is bubbling up as a critical feature of all of this. And so we need to have a lot of cooperation between public sector and private sector, those that put the regulatory frameworks in place and those that provide products and services, so that the data that is generated is, one, it has the right infrastructure, the right informatics infrastructure for the data to be collected, aggregated in an anonymized fashion, for example. Two, so that that data can be used for decision making. And in the COVID response that has been so critical, where you had ways to look at the data and do data-informed decision making, that has been critically important for how things have gone. And then obviously, a lot of this it's happening so fast that you need to have very responsive governments and very responsive private sector actors, and also very responsive individuals. And so I think there's a lot that we can be discussing, and there's a lot of benefits of this acceleration that COVID brought into the healthcare systems. It helped bubbled up a lot of the inefficiencies, and so we know where the system is breaking down, and there's then hopefully once things calm down, there will be a willingness to really fix where those things are not working. But there's also a lot of the benefits of using big data for research, big data for the purpose of providing better outcomes for the patients, and big data for the better management of the healthcare systems themselves. We can talk a little bit about the pitfalls, and of course, it is very useful to have telemedicine and all these tools. One thing that we need to be mindful of is to not over-digitize the system, so that we don't lose the connection between the patient and the nurse, or between the patient and the doctor, right? So we use it as we need, and we make sure that the connection can still be maintained. And then two more pitfalls and things that we need to keep in mind as we think through how we use big data in the digitalization of the healthcare system. One is around security and privacy breaches, and I think we can talk a bit more about that in a few minutes. And the third one is we know that there are a lot of biases that currently occur in the healthcare system, be it from the data, how data is collected for clinical trials, how data is recorded, all of that. We as healthcare actors or public health actors, we know that those biases are there. So we need to put extra effort so that those biases, be it gender, be it race, be it age, none of those biases should then be passed on to the systems and to the data sets. So I think we need to put a real effort into not having the same biases in the system. And that comes from more data, more diversity in the data, and data collected in a well-structured manner. So I leave it there, and then we can talk a little bit more about the privacy issues.
Yeah, we will. I will build on what you are saying. We need more data. Walter, you are also the Italian representative at the World Health Organization. What is the One Health approach of the World Health Organization?
This pandemic has clearly showed the need of a One Health approach. And for those who are not know what One Health approach is an approach to designing and implementing actions, programs, policies, legislation, research, activities in which different sectors communicate and work together to achieve better public health outcomes. And the areas in which One Health approach is particularly relevant is exactly infectious disease, is the control of zoonosis, the diseases that can spread between animals and humans, such as this new coronavirus, but in the past, the flu, the rabies, the Rift Valley fever. And also the One Health approach is very important in combating antibiotic resistance, when bacteria change after being exposed to antibiotics and become more difficult to treat. So this problem of coronavirus made it very clear. So because many of the same germs that infect animals and humans, as they share the ecosystem where they live in. And in fact, several of them come from China, where it's much easier to find these opportunities for viruses to spill over, because there are the tradition of having lively stocks in markets, or where people live in a high promiscuity with animals. And so the efforts by just one sector cannot prevent or eliminate this problem. So we have to work all together. For instance, just to give another example, rabies in humans is effectively prevented only by targeting the animal source of the virus, for example, by vaccinating dogs. And this has been the most important actions. And information on influenza or coronavirus circulating in animals is crucial to the selection of viruses for human vaccines for potential pandemics as we are living now. And so we have to work together. But how can be possible? It means that many professionals with a different range of expertise who are active in different sectors, such as public health, animal health, plant health, environmental health, but also space and digital technologies, should join forces to support these One Health approaches and to effectively detect, respond, prevent the outbreaks of zoonosis, but also food safety. I mean, food safety, everybody eats at least twice a day. And how can we control foods if we don't work together? So government officials, researchers, workers across the sectors at different levels, global, national, regional, local, should implement joint resources to health threats. So this is the One Health approach. It's not easy to pursue because we have been working in silos. You know, each of us has been, I mean, doctors looking at patients, veterinarians looking at animals, managers looking at organizations. And so we have worked in an environment in which we haven't really coped with this issue. Now it's time to pursue the One Health approach.
Thank you, Walter. Jan, I would like to build on that. How can space help in the epidemiological mapping and surveillance of a pandemic? To which extent the experience that we have with space in support to the Ebola pandemic, we can contribute to any pandemic in general?
Yeah, thank you. But before that, I will come to what I heard so far. And I heard especially three expressions. One was telemedicine, the other one was big data, and the third one, just Walter mentioned about the interaction of different experts. And this is something where we really can use space, because number one, what is big data? Big data is not a lot of data, otherwise it would be called a lot of data. Big data means to combine data from different sources. So if you have a credit card, if you have the number of the credit card, the name, the type of the credit card, the security code, and the expiration date, that means just you have 5 data, then you have the money. And this means big data is also something which we can use, and we are using that from space. For instance, when we look to malaria, by combining our information through Earth observation about humidity, about temperature, about the forest, flora and fauna. So then by that, you can really look where is the biggest danger of something like malaria. And the other thing is this question of different experts from different fields. We have in space a very special method when we are planning new satellites. We call it a concurrent design facility. This is a big room, and it's a physical room, where all the experts from different sectors, disciplines are sitting together with a computer in front of them. They could also be in distance, but they are normally in one room, and they are developing one satellite. And by joining the different expertise, it is, of course, a better product. And we can use, of course, exactly the same technology when we are talking about telemedicine and people, because telemedicine for me is not only to get medical expertise to remote areas, but also to get the different expertise from different doctors at any place in the world. So it's really a global solution. So using this concurrent design facility approach and telemedicine, I think we can really help. And of course, ESA is doing, as I said, with malaria. This is one case, but also in a pandemic, we have the opportunity to do tracking with satellite navigation. The communication, the raising awareness worldwide is, of course, done by satellites. And therefore, it means also we can observe what is happening now, for instance, the situation of industry. So we can follow all of this from space. But again, space can only be an enabler, a supporter, space is not giving the solution for a pandemic. Also, we are sometimes helping with our technologies, for instance, our 3D printers, to also build shields, etc., face shields. But I think it is totally right what Walter is saying. It is very much needed that we go out of our silos, work together in all different fields without any borders. I mean, without any saying, okay, this is just medicine, therefore only doctors, or this is just technology, therefore only engineers. I really believe that the cooperation, this is something which is needed, and we see it now in the pandemic, and I hope we will see it afterwards and work on that.
Thank you, Jan. To build on what you are saying on the importance of data, of big data, actually, I would like to ask a question to Vanessa. Epidemiological mapping is used in several countries. Some debates on privacy. When we talk about the digitalization and sharing of data and management of those, we get into the issue of, on one side, securing the societal protection, and on the other side, the privacy of patient, of a person. How the problem is tackled or may be tackled?
Well, thank you. And just to build on the cross-sector collaboration that Walter and Jan were discussing before, that is one of the things that is hardest to do in practice, because when you bring people, urban planners, when you bring transport experts, when you bring in infectious disease experts, when you bring in chronic disease experts, all of them, they have different languages and they have seemingly a common goal, but they need to hit different targets to get there. And so it's quite, it should not be underestimated how hard it is to have people work towards a common goal when they come from very different walks of life, and they come from very different training backgrounds, and they have different roles that they normally are performing. So just to add on that. Now, when it comes to the tracking apps or the surveillance apps, we need to think, and I'm glad that this conversation is within the European context, where there has been a lot put in place with GDPR to protect the privacy of individuals. So we are in the context where we need that privacy, and we want that privacy to be protected and to continue to be protected. And on the other hand, we do need to know, how many cases are there? How are these moving around, and what could potentially be the measures to put in place? So the question that we need to, as decision makers, need to be asking is, what do I need this data for? And are these apps the right response for that? So if I need my data to know where is the capacity of my healthcare system, am I close to rupture, or do I still have capacity there? So that's a numbers game, right? Or do I need to know so that I can potentially isolate small neighborhoods rather than having to put nationwide lockdown? So the first question is, what am I using this data for? So that the response that I put in place is the appropriate response, right? And it should be appropriate, it should be proportionate to what I am dealing with, and very important, it should be temporary. The last thing that we want is that 5 years from now, we're still going to be surveilled at the level of when I enter my house, because we had the pandemic 5 years ago, right? So these things should be temporary. And so how can we tackle, and how can we put in place some of things that will make this more useful and more and respecting of all of our privacy? So to me, number one is governments and decision makers should be communicating to the public what measures are being put in place. What do these apps do? At what level is data being collected? So when you have your head of the response or your Minister of Health coming on TV saying, we're going to be opening schools now, and we're going to be opening hairdressers or spas, I would expect that that same key decision maker will tell me, and now we're going to stop collecting this data of where you are and who you've been with. Or now start collecting that data, and we expect to stop doing that in 3 weeks, and then we will destroy that data. So it's very important that governments communicate transparently what data they're collecting, for how long they're collecting it, and what are they doing with that data. And then the other aspect is also, again, back to the interaction between public and private sector, is, okay, so if the government, who is producing these apps? Who is managing this data? Who is owning this data? Is it the government? Is it the company that has been commissioned by the government to do that? These are questions that we should be asking and that governments should be discussing. And because this is the first time that it's happening at this scale and at this speed, of course, you're not always going to get the right answers on the first attempt. But it's important to be discussing this and to give the individuals, like all of us here on this call, the right information so that we know that we're not going to be continuously surveilled forever, right? So that we know when these things are being sunset and when this data is going to be destroyed, or if it is going to be used for other purposes, for research, for planning, for preparation, then just we should know and we should give our consent if that's the case. So I think these are important questions that just because we are in crisis mode, we should not avoid asking and we should not avoid answering. And that I think is very important.
Thank you, Vanessa. Yeah, when we are we confront, how do we confront our research advancement and data protection whenever we deal with the medical research on performed by our astronauts?
Yes, thank you. I would like to come back to the question of Vanessa concerning the privacy. I totally agree with you. And when I say tracking app, I don't mean automatically what is meant in public with tracking app. Normally, what is meant is to look back in history. When did I meet whom? That's normally understood with a tracking app. There's a small startup of ESA, which was doing a totally different type of tracking app. And this is to give permanently the information, for instance, in shops and other areas, whether it's crowded or not. They call it the crowdless app. This is a totally different type of tracking. It's not about personal information, who is who and who is where, but it is about the information. Is it smart to go now to the shop to buy something when it's totally crowded? And this could be online done. And it is not, in any case, disturbing the privacy. And of course, Big Brother should remain as a book and not as something we are developing for the future. So there is some discussion now, of course, about the tracking apps also with respect to look who is meeting whom. But I'm personally, I'm a little bit afraid about, because not only the privacy, but also about the really vast amount of data which you will produce by that, because you will meet so many people. So, and it's like an avalanche. So you are asking about security of the data, Donatella. Of course, what we are doing is we are using the data from our astronauts from space, and of course this is confidential data. And so we have always good information about what is their health status. If I say we, it means the doctor, not me as a director general. I don't get the information, and I think this is really right. But of course, we have secure channels, and we are at ESA also working now on even more secured channels using quantum technology, which will really secure that data cannot be hacked, which is at that point very important. By the way, this should also be important for each and everyone using computers. So we have this situation, and therefore I think that ESA can really develop something also concerning these defibrillators, which can then on a safe way be controlled from ground. That's a type of telemedicine which is really then an active one.
Thank you, Jan. Time is running. Before giving the floor to you for the conclusion, I would like to ask, I collected some questions from the public, and I would like to ask a final question. This pandemic, we understand it may be the first of a long row. This crisis anyway is accelerating and impacting the transformation of a health system. If you have to leave 2 words and a small pitch on what you would like to leave from this discussion as food for thought, please share with us. Should I say who starts? Walter, you're nodding, please.
I think the most important lessons that we have to learn for the future is that hospitals are very important to save lives, but are relatively useless in stopping epidemics and pandemics. So the lessons is that we must have systems in which hospitals, public health, primary care, community services are working together. And I think digital technology can really play a role in this, because where people are equipped with technologies, they can even stay at home, and in times of pandemic, this is of paramount importance, not going to the accident and emergency department to spread the disease to other patients or to doctors that are even becoming dangerous as well. So I think digital transformation and having care wherever is possible, wherever is appropriate, wherever is needed. That, I think, is the most important lesson for the future.
Thank you, Walter. Fabian?
Yes, could be many things, but 2 things. I'd say one is access to healthcare services to all during pandemic time, and nothing should be restricted. Access to technology, the more that we can. Hoping that it is not taking away having access to core and basic health services like vaccination, reproductive health. Don't forget that, and probably thinking about the ethical elements when we move fast forward with using digital technologies, and make sure that data are protected, that is done ethically, and it's available for all.
Okay. Thank you, Fabian. Vanessa?
So for me, I would say prepare. Prepare, make sure that you stress test your supply chains, prepare your healthcare systems when you integrate primary care with secondary care, tertiary care, and home monitoring. That is critical. And make sure that as you prepare, you, one, talk to the different sectors, health, urban planning, consumer, IT, technology, all of that. And 2, not just across different sectors and expertise, but also between public sector, private sector, and civil society and academia. So that's my key message there.
Thank you. Beth?
I guess I wanted to say just a little thing about how impressed I've been with ESA working with like UNOSA and WHO before the pandemic happened, trying to have working groups and looking at how we can use space technology to improve healthcare before this pandemic happened. And I suppose that's the big thing really, is about being prepared, as you say, and not to have to wait for a pandemic to happen to really see these technologies being implemented real time. And we have got a lot of this technology already, and we had it sort of last year, and it's a shame that maybe a lot of it has taken all this time and the need for a pandemic really to be implemented into our hospitals for use on the front line. So I guess be prepared, and also education, I suppose, is one of the key things which I've seen from this. The ability of practitioners to be able to share their findings, share research, share subjects to involve in trials, and for sort of big scale research platforms to happen in a really short periods of time has been really exciting to see, but also a lot of work still left to do to really optimize some of the technology that we have, and to really be able to use it.
Thank you, Beth. Now, Jan, I leave the floor to you for what space can do and the conclusion of this webinar.
Thank you very much, Donatella, and thank you very much to all of you contributing to this webinar. It was very interesting for me as I'm an engineer, and normally I'm working just as an engineer. So now looking into also a little bit more in this health area is, of course, very interesting for me. And my words also would be one thing I take out of it, and I hope that we really can do more in that field, is the cross-sector cooperation. This is for me very important. And what we have to do, and this is maybe not so typical for an engineer, we have to look a little bit more to the societal future. That means what is society doing after this crisis? And I believe what we need is that people are really already now in the crisis can get some motivation how to create the future. And there space can do a lot, because how is motivation produced? Motivation is produced, for instance, by inspiration. And inspiration can be really produced by fascination. And of course, space can deliver fascination, or can really inspire people. And that means from fascination to inspiration, we get people motivated to do something better for the world. It's not necessarily in the field of space, but also, especially also in health. And that means I believe that space can deliver something, and sometimes it can just deliver something for society. Sometimes it's also delivering for industry or the environment. But for me, the societal aspect is at this part of this discussion very important. And this is what I take home, and what I really thank all of you for giving me this message.
Thank you very much. And thank you for all of you for participating.
Thank you.